Hello, dear friends. This is a case of a female patient, a 40-year-old, who presented with significant pain and swelling in the left inguinal region. The history of the patient is IVDU, IV drug user, self-injected in both sides. As you can see, there are some changes in the subcutaneous fat. So, CT angiogram was performed to rule out any pseudoaneurysm or collection or abscess. So let's have a look together and let's concentrate on the left side. So the bifurcation of the aorta looks normal, and the bifurcation of the common iliac arteries is also normal, as you can see. But going down, let's see the transition from the left external iliac artery to the femoral artery, and just here there is a pseudoaneurysm. Let's have a closer look again, and let's go back up and let's go down to see it again. Here it is and pops out. Let's go up again to have a second look. Here it is. Another interesting point is that there are some changes around the vessel, as you can see, comparing to the right side. The patient was discharged and readmitted 4 days after the first admission, and a new CT scan was performed. Let's see the evolution. This is the next CT angiogram. So let's have a look. Left external iliac artery goes down, and in the left femoral artery we can see now a very large pseudoaneurysm. However, the vessels are symmetric, there is no significant stenosis, and if we go further down we can see some stenosis in the left common femoral artery, but if we scroll down we can see that it's almost normal. Let's go a little up and down. We can see that there is some edema, some lymphadenopathy, some lymph nodes here and here, here and here, lymph nodes, and there is some fat stranding. However, the vessels show sufficient patency and width, but comparing the left with the right, no significant differences. This patient readmitted after 2 months for right-sided symptoms. Let's have a look. The patient continued self-injections and presented with significant swelling of the right lower limb, and let's have a look to the images. As you can see, there is significant swelling of the soft tissues of the right thigh. There is significant swelling, edema of the subcutaneous fat and all the muscles circumferentially. There is no pseudoaneurysm, there is no collection. This is just a diffuse phlegmon. Now, as for the vessels, there is no acute occlusion, but comparing to the previous examination, due to the edema, there is narrowing, generalized and diffuse narrowing of the vessels. Now on the left side, just in only 2 months, there are some changes in the caliper of the left external iliac artery. There is significant stenosis, as you can see, and finally there is occlusion at the level of the left femoral artery. This is just a calcification here. Here is the right-sided bifurcation of the right femoral artery, and on the left side we can see opacification of the left superficial and profunda femoral arteries, and some narrowing, generalized narrowing. So exactly here is the superficial femoral artery. If we track it up, we can see that there is occlusion. Here are some vessels from some branches of the left profunda femoral artery. So this is the superficial, and let's track it down. It's very narrow vessel in this CT scan. Here it is. So all these changes occurred in just 2 months. A very small aneurysmatic ectasia, and here is the level of the 3 run-off arteries after the popliteal artery. There are some differences between the left and the right side. The left-sided 3 run-off arteries show gradually faint and reduced opacification. And by the way, let's see again the pseudoaneurysm in coronal view. Here it is. Let's zoom in to see it a little better. Dear friends, thank you for watching this video. If you like my videos, you can consider to subscribe, so you will be notified every time I upload a new video. Thank you very much for your support.